Good afternoon and welcome back. I'm Marcus Peter. You may remember the tragic cases of Charlie Gard and Alfie Evans, terminally ill babies who died in UK hospitals after their doctors determined they should no longer receive care. Now a hospital is withdrawing kidney support from a patient over his family's objections, stating that letting him die is a clinical decision. Our friend Wes Smith joins us. Wes is the chair and senior fellow at the Discovery Institute's Center on Human Exceptionalism and host of the Humanize podcast, author of 13 books, including Culture of Death, The Age of Do Harm Medicine. Wes, thank you for joining us. How are you?
Marcus, thank you. And this is an example of do harm medicine.
You're completely right. This really is. And the fact that it can be couched into something as cold as a clinical decision just demonstrates how far we've come.
Yeah, this is happening in the UK, but we've had similar cases here in the United States. What happened here in the UK is a man suffered a stroke. There's no question he's in a very serious condition. And, whether a life is worth continuing to fight to save is a value judgment. That's not a clinical judgment. It's not, for example, saying, well, you have a tumor. That's a clinical judgment. But whether I should continue to, for example, receive chemotherapy, that's a value judgment that a patient or a patient's family or a patient surrogate should be making. So this is another step in what I call medical hegemony. That is, we are moving from a situation in where patients make the ultimate decision to refuse or accept treatment to doctors saying, we'll decide whether your life is worth living. And doctors are not any expert in values. They are expert in, whether somebody has a disease or what the prognosis might be. But this has no business being a clinical decision.
I want to ask you to speak to, you and I have talked about the U.S., we've talked about Canada. Can you please speak to the legal medical milieu of the U.K.? What's been happening in terms of its trajectory?
Yeah, it's getting worse and worse in the UK. I mean, a lot of what's happening with the National Health Service is an implosion. For example, hospices are in terrible condition. Many of them can't operate because they don't have funding. At the same time, you've got the government and the House of Commons pushing assisted suicide. So one begins to think that perhaps the ultimate purpose of some of these bills is to help in terms of finances. I was blessed and honored to interview for the book Culture of Death the founder of the modern hospice movement, Dame Cecily Saunders. And she was adamant that her patients have equal dignity. And what decisions like this, where you're saying that whether somebody should live or die is a clinical decision, that denies the equal dignity of the patient. Catholic moral teaching, allows people to refuse medical treatment if the suffering outweighs the benefit. But the person who's supposed to make that decision is the patient or the patient's family, not the doctors.
And what we're seeing here is that it's not just about families and those who legally have power of attorney or, in this case, the right to make legal medical decisions. It's that the state and therefore the medical institutions that are taking over the life choices of patients.
Yeah, and they're also preventing changes that would get these patients to other forms of care. You mentioned Charlie Gard and Alfie Evans. Those were children. This case is not involving a child. But you may recall that there were places willing to take a Hail Mary shot at helping Charlie Gard and Alfie Evans, other hospitals, and the hospital wouldn't release the child. And the same thing has happened in this case, where the doctors not only say, we're not going to treat you, we're not going to give you what your family wants for you, which is continued kidney dialysis and so forth, we're not going to let you transfer the patient to another institution that might offer that care. So, whose life is it anyway, as it was an old play that dealt with assisted suicide. Well, what's happening is if you want assisted suicide in many places, we'll say, oh, yes, patient autonomy. Wait a minute, I want to fight to life. Well, autonomy has its limits.
Autonomy truly does have its limits. And so, in this situation, does the family have legal recourse?
Apparently not. Now, the UK has a different system than we do. And the Charlie Gard and the Alfie Evans cases, the courts were involved and they said, look, it is in the best interest that these child die, which was terrible, but at least you had the courts getting involved. What the hospital is trying to do in this case is keep the courts out of it so that there is no check and balance, no ability for the family to bring in witnesses and that kind of thing to perhaps have a different result.
In such a situation, then, just like the situation with Alfie, what we're seeing is another case of futility, and therefore socialized medicine needs to be legally curtailed.
Well, we've got the same. I'm not denying that. I'm not certainly in favor of NHS or Canadian-style healthcare, but we have problems too with our insurance companies. Mm-hmm. So I think there's no perfect system. But the socialized system does not work at all. In Canada, as an example, particularly when you start getting euthanasia in it, in Canada, you have people who can't get oncologists for months and months and months after they've been diagnosed with cancer, asking to be killed instead. In Canada, you have what they call MAID teams, MAID, medical assistants in dying, that literally go to people who may have a serious medical condition and saying, you might qualify for a peaceful death. It's really quite remarkable.
The startling thing is, even in that situation, because of the pre-existent laws, challenging it means doing it at the detriment of the life of the patient.
Well, yeah, and in this country, we've had cases out of Texas, in particular, the Tinsley Adams case, in which a young girl was supposed to. The doctor said she doesn't have a chance. Put her into comfort care. The mother fought and fought, and the doctors refused to give her a tracheotomy so she could be removed from the hospital. And eventually, thank goodness, the Texas Supreme Court said, no. This isn't your call. And actually the terrible feudal care law of Texas, which I'm sorry to say was supported by the Catholic Hospital Association in Texas, was changed and not done away with, but certainly made somewhat less onerous. These things need to be fought.
In the United States, given the way our Constitution is written up, our Bill of Rights, and the separation of powers, do we have more of a recourse for these cases?
It's most of these cases are going to fall under state law and under state kind of constitutions and statutory involvement. Getting the federal government involved, federal law involved, is difficult, although not necessarily impossible.
Now, in the face of all of this right now, as you inform us about this particular case and other cases that are coming up, what can our listeners do to not only get more involved, but also have our voices heard? We don't live in the UK, but clearly something can be done to advocate for these lives.
Yeah, well, I think every patient, especially if they're seriously ill, needs to have somebody to be their advocate, somebody who they trust. Certainly we should sign advance directives appointing people who can be our power of attorney for healthcare in the event that we're unable to make our own decisions. But even when we make our own decisions, this is a daunting situation. If you've been diagnosed with a catastrophic condition, you're going to be in such a state of shock, you may not even remember what the doctor said. And so it's always behooves us to have a loved one, a child, a parent, a sibling, a close friend, even a priest, there to advocate for us so that we make sure that we're not pushed down a road that we really aren't choosing.
So as we look at Andrea Williams, the chief executive of Christian Legal Center, I'm really glad that she and her team are supporting the family of this poor person in the UK. Wes, I also want to say thank you for drawing our attention to these cases.
Well, thank you for having me, Marcus. Because of people like you, the reach actually extends.
Well, these are important conversations, and I look forward to having more of them. My guest has been Wes Smith, Chair and Senior Fellow at the Discovery Institute Center on Human Exceptionalism. We've been talking about the fact that in the UK right now, a hospital unilaterally cut off life support for a disabled patient despite family objections, and unfortunately, that's the new trajectory. Stay tuned, I'm Marcus Peter.